4, 3, 2.
Good morning. Carol Dixon with Idaho Federation of Families, and welcome back to another Federation webinar, parent webinar that we've been having kind of on a monthly basis. We are doing a new collaborative project right now that we're really excited to bring to families in Idaho. It is a collaboration between the Department of Health and Welfare, the Behavioral Health Project, Youth Empowerment Services, Parent Network, and also the Idaho Federation of Families. And what we're really trying to do as the YES Project is kind of bringing some new services online, and they're coming to be available to families in the future, is provide information about what to expect, what they're going to look like, so that you can ask questions and you're a little more informed as you're stepping into them. So this is, I think, probably one of the second or third ones that we have done, but know that coming across the months all the way through summer and fall, we will continue as new things come up to provide this collaborative effort. So this morning we have Janet Hoeke with us. She has been with us many times. She's with the Parent Network. Jennifer Fishman is with Department of Behavioral Health, is a program manager.
Jennifer Barnett.
Jennifer Barnett. Thank you, Jennifer. Sorry about that, Jennifer. It wasn't Jennifer Fishman. There's also Jennifer Barnett.
Yep.
And then Andrea Emmons, and she is with Liberty Health, and she's an assessor for the CANS, which is the Child and Adolescents Needs and Strengths Assessment, and that's what this conversation is about today. There is the ability, as you're watching, to ask questions. We will put up the slide that tells you where you can email those questions to. They're going to come up, and Janet is going to be able to get those, and they will then answer questions. So please, as we go along, if there's something that doesn't make sense or you want a little more information on it, send us that email and we'll get that question answered. This webinar and future ones will also be archived on both the Federation's webpage under Parent Education. There's an archived webinar, and also under the YES, the Youth Empowerment Services, there is a tab that is for, hold on one second, about YES. And if you go into that tab, there's a resources and training, and that's where you will find these webinars specific to anything about the YES program. So with that, ladies, any other information that you want, please jump in and do that. I definitely want Janet to talk a little bit about the Parent Network, because we continue to want to make sure that parents are aware of the network as a resource to them. So she will throw that information at some point in time. And thanks again for being here.
Thank you.
Important stuff.
Pleasure. Just working on getting the slides up, but so I'll just introduce myself. I'm Janet Hoeke. I am with the Idaho Parent Network, and we are a group of parents throughout the state. There are parents in every region of the state who have been involved with the YES project. Some for a shorter period of time. Some of us since it really went from the very beginning. We have a parent that actually was on the original mediation team. We are all parents with lived experience with children with mental health disorders and serious emotional disturbance, and we are here to help families and to help the state get parent feedback on what is and isn't working, and how we feel the services and supports can be implemented to best address parent need. So the email address that you see up on your screen, pnregion4@gmail.com, is my direct email address through the Parent Network. And I am more than happy to receive any kind of phone calls, or, well, you can't phone call an email address. How about any kind of emails that you have? Get the answers for you live here, but if you have questions afterwards, please feel free to email me at that address, and we can get you in contact with the Parent Network in the region that you're in. So, Jennifer.
And I'm Jennifer Barnett. I am with the Division of Behavioral Health in the Quality Assurance Unit. And I have been working with the YES project for really from the beginning with Janet. And I'm here today to provide an introduction to the CANS assessment tool, the Child and Adolescent Needs and Strengths Assessment. And then we will be having a dialogue here and be able to answer any questions that you may have regarding this assessment tool, how you go through the assessment process, and really what is the parent experience or family experience going through that assessment process.
Hi, I'm Andrea Emmons. I'm a licensed clinical social worker. I work for Liberty Healthcare, and I'm one of the independent assessors that actually comes to your home and does the CDA, the assessment, and the ICANS testing. So I'm looking forward to hearing from questions from actual families to see what I can help you to learn more about what we do from my side. And I look forward to being here today. Thank you.
I think we'll go ahead and start with the webinar.
Yes, we do. Thank you.
So just a little overview. Again, in this webinar, you'll learn or hear about the CANS and why it is the new assessment for children in the new children's mental health system in Idaho. We will talk about how do you assess using the CANS tool. And really, like I mentioned earlier, that this is an open forum. We're going to have a really laid-back discussion about issues that come up or questions that we may have already received from parents or community mental health providers about the CANS assessment tool and the assessment process. So let's go ahead and move on. As why the CANS might be a question for individuals out there. The YES system of care is the result of a settlement agreement from a 39-year lawsuit called the Jeff D. class action lawsuit. It came about in 1980, and the defendants in the lawsuit are the Department of Health and Welfare, which includes the Child and Family Community Services, the Division of Behavioral Health, the Division of Medicaid, the Department of Juvenile Corrections, and the State Department of Education. Those are all the defendants within the lawsuit. And as part of that settlement agreement arising from that lawsuit, a new children's mental health system of care was to be operational by May of 2020. The state will continue to be monitored and report to the court for 3 subsequent years to monitor for sustainability. Really, is this new system of care not only operational, but is it working with all of those partners involved throughout the state of Idaho, and really supporting children and family in need for mental health services. Another part of this settlement agreement was implementing a new assessment, and the state decided to use the Child and Adolescent Needs and Strengths assessment tool that is created by the Prayed Foundation.
One of the things that's interesting about that, or that parents may want to understand, is that the CANS tool that was selected with a lot of parent involvement. That was the tool that the parents identified as being the one that really would be the most beneficial tool for families in the state of Idaho.
And I think all of the partners and stakeholders that were involved in making that decision really found that the CANS was a tool unlike any other. It really is designed to look at the child and the family's needs and strengths, and really focused on being able to find and identify any unmet needs through a screening and assessment. It is there to be able to support clinical decision making and practices, including treatment plans and level of care decisions. It is a measure that is there to be able to communicate the outcomes at the individual, program level, and the system level. It's there to be able to provide assistance with service coordination and quality. And it is also designed to be able to replace any other assessment tools that were utilized in the state of Idaho regarding level of care decisions. And really, when you're utilizing the CANS, the best practice is to use it as a communication tool. It is there to be able to gather and collect the information of the story of the family, the youth, and any providers that might be involved with that child and family.
So one of the things you'll hear us talking about over and over today is the unique quality of the CANS. Previous assessment tools were always deficits-based.
Yes.
They only looked at what was wrong with the child, right? They didn't look at where the child's had strengths, where the family had strengths, and the needs are done in a non-judgmental way, right? It's really about the what, not the why, right? So this is something that you can feel very comfortable in as a parent going into the assessment. You'll hear us talking today and describing more about this because it is a non-judgmental. It is about the what. What is going on, what is happening, where are the strengths, where are the needs, and that's one of the very unique qualities of this CANS tool you'll hear us talking about today.
Right. So you might want to know, well, how is it completed? How is this unlike anything else? How does it focus on the strengths and the needs? So the CANS tool for someone to be a provider of the CANS assessment, they go through a certification process where they are rated on their ability to consistently assess children and families and apply the different rating based on that family story. And so that certified provider of the CANS tool, they'll meet with the youth and the family in a place that is comfortable to them, that's hospitable, and it's really based on how that family or that child would like for that assessment to occur. And they'll use that CANS as a way to gather the information or gather the story of the family, the what has happened for that child and family. The CANS is then utilized as a collection and organization tool, either for during the process of completing the comprehensive diagnostic assessment or CDA, or following that CDA process. And it's really not meant to be utilized as a checklist. For example, if a child has an episode or experience of trauma, when those questions come up, it's not a, well, have you been, assaulted? Have you been abused? Have you done, it's not a checklist. It's really, the story has these elements in it, and this is how we'd end up rating it based on those elements in the story. So it's a collection of information rather it being a checklist of whether this has occurred or not. The ratings then on that CANS assessment tool is then used to translate immediately into action items for treatment planning. So depending on what the rating is for that specific domain or issue for that child and family, then that can be used to create an action step for that child and family. I think you were going to say something, Jen.
Right. So a lot of the times as parents, we've been somewhat trained on how to take assessments when we go in for our children, right? I mean, for me, one of the most common assessment was a CIVAR. And it's, it is more of a checklist, like Jennifer said. It is, can your child do X? Yep. Can your child do Y? Nope. Can your child do Z? Nope. Can your child do A? Nope. Okay, next page, right? We aren't really thinking about things in terms, in a larger scale, in terms of a story, in terms of what has happened, what is the story of our family. And so when we think about ratings, we had a conversation with Dr. Lyons, who's the head of the Parade Foundation and the founder of the CANS. And he said that in a lot of states, what they use to help parents are some words that help translate the scores. So there's a 0 to 3 as the rating scale, right? And so he gave us some words to use. So in terms of a need, maybe think of it as, I don't worry about it. Does your child have anxiety? I don't worry about it. It's not an issue, right? Or I worry about it. Or yeah, we need to do something about it. Or this is an immediate, like we really need to get on this right now, right? So there's your 0 to 4 in terms of being able to think about things. So when you're having this conversation, as we'll talk about even more later, it is very helpful to have that thought in your mind when you're talking about what your child needs, right? Well, what are the things that you worry about? What are the things that you really need to do something about? What are the things that you can't wait, something needs to be done today? That's really a good way of thinking about the child's needs. And for strengths, you can think about it in terms of, it's a focus of the plan. It's what we're going to build some of the helps and the supports around, or it's useful information, it's a useful strength of mine, or we've identified it but it's not really developed, or it's just unidentified. We don't really think of that as being a quality or a strength that we have. And I think that can be helpful. We'll talk more about that, about how that can be helpful to parents in terms of thinking about the conversation when you're looking at the ratings for your child.
And to piggyback on that, so depending on the ratings that are identified on your child's CANS, if you have something that is in the needs side a 3, and that's something you immediately want to have some action on, then that's where in your process of treatment planning you create a goal around that 3 level of level of need. Or on the strength side, if you have a 3 on your strengths, meaning that there's no strength identified there, then that's probably something that needs to be a goal developed around that unidentified strength. So there we go. Let's go on to the next slide. There we go. And so now we're going to just turn over to Andrea here and have her talk about the use of the CANS that Liberty Healthcare is out there assessing kids and families utilizing the CANs. And so, Andrea, if you'd like to talk a little bit about your process and just really utilizing this new tool in the children's mental health system of care.
Yes, I'm so excited about this tool. I've had the privilege, I've worked in agency, I've been doing this for about 25 years, so I've gone from big agency to little agency to my own private practice for quite a few years. So I've seen the gamut of different tools that we have. I've also seen how the previous tools have really focused on there's been no strengths involved. There's also not been a family needs involved. And so I love the ICANNs because we capture what does the family need, not just what does the child need, but what does your family need, and what makes your child great. We never looked at that before, and so all of our kids, they have something really great about them, and we can kind of work on that strength and build that for them to, for the families and the child. So I really, the ICANNs is a great tool. It's also based on, I know from past experience, families are not used to being thought of that they are the expert. We really go from the approach that you are the expert of your child. I'm here to just kind of help you direct what the needs are, help you direct what the strengths are, but you are the expert. You are reporting to me. A lot of families feel like they're not heard, their voices are not heard. I've met with a lot of families who felt hopeless in the system, and this is a tool that gives families hope. I'm so excited to share this with families because they can be very hesitant before I come into their home. Like, oh, are you going to do a home study? Are you going to look at my home, make sure I have smoke alarms? I want to come into your home, and I want you to be comfortable. Most of our homes are lived in because you have busy kids. So keep your houses we don't need anything picked up, cleaned up. We want to sit wherever you feel comfortable, a couch, a table, whatever is best. And then just give the story of your child. Give the story of what it was, even from birth till now. I want to know about when you started noticing issues. I want to know about, what makes your child unique. What are his strengths? What are her strengths? So it's a really great tool to capture things that we've never captured before. So I also believe that this is going to help change the whole concept of mental health in the state of Idaho. I know in the past we haven't done the best job, and this is a way to really utilize and help the kids and find out what we need. So I'm really excited about this ICANNs tool, and also to really let the families know you are the experts. We're here. You tell us your story. I'm going to put it on paper, and I'm going to help design it for you, but you are the author. So it's a really great opportunity for families. And the great thing about my company, Liberty, we're independent. We're not affiliated with big agency, small agency. We're completely independent. So we're on your side. We want to know what is best for you. And Liberty will also allow us. I've had sessions that lasted an hour and a half, and I've had sessions that have lasted over 4 hours. Whatever it is that you need is what we're here to give you, what we're here to guide you through. If you need a little extra TLC and explanations, I'd love to give that to you. So, and we're also very trained. There's a lot of, all of the clinicians that they hire, we're all, clinical level. We all have lots of experience in private practice. We've all done diagnosing for years. So we have an expertise that kind of allows us to we understand your story. We understand some of those diagnoses that not everyone understands, like RAD. So it's a great opportunity. It's a wonderful tool to really measure what we could do to help you with. So it's awesome.
So Andrea, Liberty, as you said, they're an independent assessor,
independent,
right?
yes.
So explain to us when does a parent need to go to Liberty for a CANS versus other options? And Jennifer, you may need to jump in here too in terms of what other options are available to parents, because there is a specific time when a parent needs to go through Liberty and other times when they may not need to go through Liberty for the CANS.
Well, most of all of my clients have been referrals. Someone calls Liberty to set up, and it's been referrals from, the developmentally disabled side. It's been referrals from children's mental health who need respite. It's been referrals from agencies. It's because, we're independent, and so we aren't driven by how many hours your child needs to care or what we think that the program should be. We're completely independent, and we want to kind of guide and create a treatment plan that fits you. The difference, person-centered treatment planning has been talked about for years. It's never really made a hit here in Idaho until now. Now, part of when we create the ICANNs, after that, the Department of Behavioral Health sets up a person-centered treatment plan with you, which means you guide it. That's first. It's usually agency-driven and not child-driven and family-driven. When you create the treatment plan, you help decide what it is best for your family. So it's really, you get what you want out of this, which is really exciting.
So Jennifer, can you talk maybe a little bit about why would a child at this point, what are their options for a CANS, and
So-
how do they choose where to go?
So if you are currently involved with the behavioral health program through Medicaid, and you are currently involved with that and receiving services from a community behavioral health provider, if you find that under the new YES system of care that you would and your child would benefit from respite, then you would want to contact Liberty Healthcare to be able to begin the person-centered planning process by having a CANS completed. If you are currently involved in the Medicaid system and you are going through that Liberty assessment, then as Andrea said, you would then be contacted by your region's children's mental health clinic to continue with that person-centered planning process. And that person-centered plan really is designed by you and your family for a service plan. Mm-hmm. So any service that you identify needed for your child or your family, so respite or maybe individual psychotherapy, or maybe a skills-based kind of training like community-based rehabilitative services, then it would need to be identified on that service plan so that you and your family really have a roadmap of how you and your family are going to go through that children's mental health system. It really is based on your vision and the mission that you and your child have for your child's mental health care.
And also based on the needs and the strengths that are identified in the CANs that
Correct.
will tell you when we run across those, like we were talking about numbers, the threes,
Correct.
it's actionable right now, the 2s and 3s. Those all have to have a corresponding.
And I think it's really important to add, too, that this is not just for Medicaid families. We do assessments on any family, whether you have insurance or not, or whether
Correct.
you've been in the program or not, or whether you've even been to counseling before. So everyone is available to try this. Everyone's available to get the assessment done and see if there's needs. The criteria we have is a serious emotional disturbance in a child. And that could be anything from ADHD that's pretty severe to reactive attachment disorder. So it's a huge gamut of anything of mental health your children might need.
Right.
And the key here, too, is there's no cost to families. For if you have a child, you don't have Medicaid, and you have a child who you believe does have a severe emotional disturbance, you can call up Liberty and have the CANS assessment done for your child at no cost to you. And I know that there's been another webinar on the access, but I did want to make it clear for families here, when you would go to Liberty versus, I know in July things are changing with the state, and community mental health providers will be able to provide the CANs. So if you already have Medicaid, you don't need Medicaid. And again, go back and watch the access webinar. If you have questions about you don't have Medicaid, but you'd like to maybe potentially get Medicaid for your child that does have a serious emotional disturbance, I encourage you to watch that webinar. But right now, you will be able to go as of July 1st of this year. You should be able to receive a full CANs from your own mental health provider, community-based mental health provider. They should be trained in and completing that as of July.
Correct. And just as another aside, if you are, depending on your insurance, whether you have Medicaid or not, if your child is identified as having a serious emotional disturbance, you can also have a full CANs completed through your regional children's mental health clinic. And so if you've gone through the Liberty process or haven't gone through the Liberty assessment process and want to reach out to your children's mental health clinic, regional children's mental health clinic, you can do that as well and have a full CANs conducted.
So talk to me a little bit about the process of the CANs. What does it look like for a family? You talked gracefully so much about coming into the home and acknowledging that when this person comes to your home, they're not there to assess anything other than your family's story. And they're really not even, they're there to gather your family's story. So you don't need to worry about them turning you over to CPS or calling, right? These are all things that we fear because we've never had services in our home before. But the reason they're coming to our home is that this is family-centered. And we understand and know we're running to therapy appointments and we're running to this appointment and that appointment. We're running all day long, right? It's how much more convenient would it be to be able to have the provider come into our home? If that's not what's convenient for you, obviously, like they said, we can make arrangements to do it elsewhere. But do know this is not supposed to be a threatening thing to have them come into your home. But then talk to us a little bit about what does the process look like? We've talked about it being a conversation and not a checklist. And And then, so what happens as they're going through that conversation, and then what happens when the conversation's over? What does that look like for the families? What do they get to see? What do they get to take with them?
Okay. Well, it starts off, we come into the home and we have a mountain of paperwork, but some of it's just, again, information, just education. So we give an ICANS brochure that talks about the ICANS tool that we do. We do a list of contact numbers that might be helpful. We talk about, if you do get onto Medicaid, exactly how to do that, a step-by-step kind of protocol for that. We go over what the consent materials are. It's consenting us to actually allow us to do the ICANS test. We also have a privacy policy, so your information is very, very private. We're not allowed to share that with anyone unless you give us permission. It's also, you sign something that say, we can share the information with the Department of Behavioral Health. And so we go over all of that. We have a nice long discussion about what this means, what this is, what we're going to be doing, just try to kind of get to know each other a little bit. And then when we start the assessment part, we just talk about everything. We talk about, what is it you're looking for? I look for, what is your goal out of this? What do you want? So it's a great opportunity to ask any question you might come up with. We talk about symptoms that your child's having. And again, you're the expert. They don't have to be perfect clinical symptoms. We're looking for, from your perspective, what do you see? What's going on? We want to know the entire history. Did you start noticing things when your child was 2? Did you start noticing things when they were 13? Whatever that is, we want to know the actual story, not just what's happening today, but when did it start?
So, Andrea, what happens if part of that story is some traumatic event that the child experienced that just talking about it again is going to re-traumatize that child, and then you're going to leave and they're going to be stuck with a re-traumatized child?
Yes.
So
when I make the appointments, I always kind of go over what we're going to be doing during assessment time. I also always let them know if there's we do talk about traumatic events that have happened or anything adverse that's happened to the child in their life. So I let the parent know if this is going to be upsetting in any way to the child, we can either talk about some of it now or we can make sure that the child is excused from the room. They do not need to be present the entire ICANS. We want to see them at least 20 minutes maybe, just so we can kind of have some eyes on. Some kids like to be involved, some kids like to ask questions. So we kind of let it gauge with what is the best fit for your family. We don't want to re-traumatize your children. We don't want to bring up things that are going to upset them. So we, again, allow you to decide, because you're the expert, what's best for your child. And then we'll guide from there. So we do, we fill out like the assessment. It's kind of like a CDA, which I'm sure if you've had any kind of mental health, you've had some CDA experience.
And what does a CDA stand for?
Comprehensive Diagnostic Assessment. So it's kind of talking about the things we're talking about: trauma, needs, history, medical, what's going on with the medical history. We make sure to talk about any cultural or spiritual values that might be important to the family. We talk about family needs, family strengths. And my favorite part is the child's strengths, because they have to be there for that. I make that kind of a fun. What do you want to be when you grow older? What are you good at? And then they get input too. I make sure the family also says great things about the child, because that always makes them feel good. What's great about your daughter? And then the families light up and the kids light up. And so the parts that the kids are involved with is I try to make it a very positive experience for everybody. So we take all that information. We take as long as you need. Some families need more time. Some families need less. And we kind of compile all of that together. And then we'll take a little break. I'll kind of go over what we've gone through during the assessment time. And then I'll look over the ICANS. We've been doing it enough, we're pretty familiar with them. So I'll mark the ones that I know and why. The needs, the actionable items, the why. But if we missed anything during the assessment, I'm going to go back through and ask you specifically, just to make sure that we capture anything that could possibly happen, or anything that the child might need, or the family might need. So we do take that break to kind of make sure we've gathered all the right information and everything is marked appropriately. So it really, even our sessions are kind of catered to what's best for the family, which I really, again, love that Liberty allows us that freedom to take as long as we need, or if you need a quicker assessment, we can do that too. We talked to you about, if you'd like it in your home, that's great, whatever is most comfortable. I've had some families, when we do it outside of the home, we can meet. I've been at the library. I've met at, we can also meet at the office if you'd like. We can meet at schools. We can meet at, even Department of Behavioral Health. So whatever is the best fit, and even location and time. I've driven out to McCall. I've gone to Horseshoe Bend. Whatever is most convenient for you. So it's really set up for that.
Yeah. I just wanted to jump in on some of what Andrea was saying is that, again, how the CANS is unlike any other tool is that the process that Andrea is describing is it creates a situation where you as the family, the child, really begin to give their story in what is relevant to them, what's important to them, and it's creating what your theory of change is. And what that means, those are prayed words for saying, what is it that you as the parent or the guardian, and what does the child say is the reason or the things that need to end up getting changed, versus many other tools or assessments end up looking at what the clinicians rationalization or what their understanding of the problems are. And so it ends up not being in your words, it ends up not being in your story, because clinicians will end up making an understanding of the problem versus it truly being your understanding of the problem. And so that's what really differentiates the CANS assessment tool from other assessments, is because of how the process by which the CANS is conducted, it ends up being your story and an understanding of what your theory of change is.
There's no such thing as a cookie cutter assessment in this kind of field. I know sometimes big agencies, I know we've seen treatment plans and CDAs, and they seem, there are a lot of familiarities between the two. This is so unique to your family and your child. We know that every child is different, every family is different, and we want to make sure we capture that. It really is a story rather than a cookie cutter, you have ADHD, so here you are. ADHD presents in a million different ways, and families present in a million different ways, as do children.
And as a result of it being your story, you have the right. And the clinician, regardless of whether you get your CANS eventually through your private provider, through Liberty, through the Department of Behavioral Health, they should be going over with you before it's finalized, both the narrative and the scoring on it, so that you all are in agreement. It really is a document of agreement. You agree that these are where your child's needs are, these are where your child's strengths are, and this is the narrative of your story. So not only should you be looking at that beforehand, but then once the CANS is entered and finalized, please request a copy of the full CANS so that you have the narrative and the scoring on it, because that can be helpful when you have other providers. If you end up changing providers, you can take that to a new provider, or if you get your CANS through Liberty, you may need to take it to Department of Behavioral Health, or in the future when we have providers in the community, you can take that to them, and then it can be updated. It is a living document. So that is one of the great things about this too, right? So tell us a little bit about how is this a living document versus like our old CDAs?
Sure. So the CANS is when after you complete the first CANS, full CANS, then it is updated every 90 days. And it's not that the family and the child have to go through that entire process again. Rather, the person that has been certified as a CANS provider, they will go in and update any changes in the different domains that where changes may have occurred. So if you were rating a 3 in the the communication domain, or how you communicate with others, if you rated a 3 there, but there's been an intervention like psychotherapy or maybe skills-based training, and after that intervention there's been improvements in how you relate to, as a child, relate to others or communicate with others, then that's what would end up being changed on that CANS, and then anything else that wasn't changed, they would remain the same. So it's a living document in the sense that you're only updating the things that need to be updated. And so it's updated every 90 days. And now that the state of Idaho has gone to a web-based platform, the ICANS, Andrea has mentioned this, we're going towards a system where we're hoping to have one child, one CANS, so that it can be utilized throughout the state of Idaho, and that multiple providers or multiple individuals that would have access to the ICANS platform would be able to see your child's CANS, and you're not having to retell your story over and over again.
I think that's a really important point, because I know just even coming from agency, it was always a frustration just even from my end, and not nearly as frustrating for the parents, but nobody talks. No one, agencies wouldn't speak with agencies. You had to tell your story over and over and over again. And I know for some this feels like, do I just have to tell a bunch of people my story again? This is what I like to tell parents is it's a root, and it grows. So this is the base that we go off of. And now agencies that come and work with you from different perspectives, different angles, different types of agencies, they can go from this root now. And we can all talk, we can share. It's a way to get the best service for your child too, because everyone's kind of on the same page. Whereas before, agencies kept everything to themselves, and it was really difficult to get people to collaborate. So I think this really encourages the collaboration as well.
One of the things I wanted to ask you, you brought up, it's updated every 90 days, right? So say we do our initial cans, and one of the things we identify is my child needs help sleeping. My child never sleeps, right? And so over the course of the 30 days, we got our child a new medication, and now the child sleeps like a dream. How do we update the cans?
So I think what you're talking about is, and if you have attended any of the CANS trainings or webinars online on the yes.idaho.gov or dhw.idaho.gov. Sorry, excuse me. If you've attended any of the CANS webinars on there, or if you've seen webinars on YouTube with Dr. Lyons, is that the CANS, you rate the child, not the treatment intervention. So using your example of a sleeping medication, if a need for sleep was identified on the CANS and you go ahead and provide an intervention such as a sleeping medication from the qualified provider, then you would end up rating the kid still maybe as a 3 on the CANS because they needed that sleeping medication. Because if we remove that intervention for that child, you'd be back to where you were at. Mm-hmm. So you still want to rate on the CANS that highest level. Now, let's say after a year of intervention, plus whatever other needs were addressed on the CANS, let's say now the kid was needing to only visit their medicine provider every 3 months instead of every month. So you might change that rating for that intervention. They still need it, but maybe it's not as severe, such as a 3. Maybe you'd bump it down to a 2. So I think it would depend on what other needs were getting addressed, overall the presentation, and the strengths that maybe had been built for that child. Because maybe now that they've got sleep, they're actually better able to function in school.
Yes.
So that level would change on the CANS as well. So it really depends on what you identify as that target need.
And I think it's important to recognize too that we're trained to find that, to do some research and figure out what the real need is. Because I've had families like, I ask about sleep. It's such an important thing for children, and families like, oh yeah, well they sleep fine now. So then, a lot of other agencies then, where providers would just be like, okay, well, that's not a need. Well, we've been trained to like, okay, well, they used to have a sleeping problem, we're little detectives. We want to help you guide to what the actual needs are too. So it's important to know that we're trained to kind of catch those. They're sleeping good now, but we know it's only with medicine. So that kind of helps.
Mm-hmm. Right. Yeah, no, I think that's very helpful for families to be able to understand. It's a complicated thing to understand. It's your child and not your child in treatment. Mm-hmm. And a more extreme example of that would be a child that was in residential care.
Yes.
So knowing that when your child is in residential care and they're getting a CANS possibly coming home, that according to if I understand what you're saying correctly, that if a child had a 3 on aggression or a 3 on self-harm and went into residential care, and that's a very structured environment, right? I don't want to say boxed in. It's a very structured environment, right? There's a lot of structure and supports that are provided in a residential treatment facility that are not provided necessarily in a home or a community. So it's very important for a family to understand when your child is coming home, they may look like they're doing fantastic in that structured environment, but the CANS will still reflect where the child was prior to going into therapy as they come home. And then seeing with the new supports that they have at home, then that may get reassessed at a 90-day or a further assessment down the road, but that knowing that when they come home, they're not going to go into treatment at a 3 and come out at a 0 or a 1. That would be an inappropriate way to score the CANS.
Excellent.
So that's very good. One of the other things I've heard a lot of parents talk about is the notion of relevance. One of the things that it says on the CANS, or when you're going through the CANS, they talk about it being in the last 30 days, right? They want to know, well, what has happened in the last 30 days? And it really is what is relevant in the last 30 days. So can you talk about that a little bit? The difference between what's happened in the last 30 days versus what's relevant in the last 30 days?
If something still affects functioning on any level, we're going to mark it. Even if they've had 30 days of great behavior, but something still maybe affects their functioning in some way, we're still going to mark it as a need. So it doesn't have to be present the day that we're doing the assessment, or even necessarily within the 30 days. If it still has some reflection or affect on functioning or just behaviors now and recently, then we're still gonna mark those items.
So it could be something that happened 6 or 10 or 12 years ago, where they had some significant trauma event or something else that's still impacting.
Absolutely.
Maybe they're terrified to leave home because of this traumatic experience.
Yes.
If it still affected them in the last 30 days, then it's still relevant and would
Absolutely.
still be scored.
Yes.
And I think the other thing that you're talking about, Janet, is also then how is that utilized in treatment planning? And so once your child has had the CANS assessment, a community provider or a regional children's mental health clinician would take a look at those 3s that are on the needs level, the 2s those are all actionable items, needs that need to get addressed immediately, or if you have a 2 or a 3 on the strength side. And so when you're looking at then what needs and strengths are we going to utilize to create that treatment plan, you're going to want to look at what relevance does it have for you. So I'll give the example of if your child has a history of trauma, that is a background need. And we're not going to change the fact that they had that trauma, correct? Right. But how they're coping with it, that might be how you're going to address it. But maybe they're in the course of their life and having had that experience, they have developed or they don't have some skills that need to be able to cope with it. And so that might be, on the strength side, a 3, meaning that there's no identifying strength related to that trauma. So even though we're not going to change the issue of the trauma having happened, maybe the result of it or how they're going to be able to cope with it, we're going to build some strengths in the treatment plan for them to be able to address and cope with that trauma. So again, it's about the relevance of what that means to your child, what that means to your family. The trauma may be impacting the family because the kids coping with it is creating more disruption within the family. And so again, unlike any other tool, the CANS and the ICANS in Idaho looks at not just the child, but the family and how that's impacting you and what's the relevance to your child being able to function at a better level, really for your family to move towards your goals.
So one of the things I'm hearing both of you describe is that the CANS tool really isn't about just getting help or getting more help. It's about getting the kind of help that you need for your child. And that's something that, as a parent of a child with a severe emotional disturbance and also with a severe developmental disability, there's never been enough help. So it's always been about just getting more help, versus now it's about not necessarily getting more, but getting the right kind of help, the help that meets our children's needs and strengths. And that's a really cool thing to be thinking about, is that, it's easy to think more is better, but as parents, we've all gotten maxed out on therapies. We've all gotten the voice like, if I have to go to one more therapy, I'm just not going to be able to breathe tonight. And, so this is a great thing that we have a tool that, when my son went through these kinds of things, we never talked about his strengths. We never talked about what he did well. And we never talked about that, especially in light of how can we use those things that he enjoys, that he does well, that are really good strengths for him, to improve areas that he really struggles in. And that part really, as a parent, it really excites me to hear you all talking about the fact that we're incorporating what it actually looks like for my family. What is it, what does it actually look like on a day-to-day basis? And where is a need, even if it's, where's something that we need to do now, and how can we help, and how can we improve those things or develop strengths? Like you said, if you have a trauma in an area, you might have no strength that will help you deal with that. And yet, over time, we've all seen people who have dealt with trauma, and they make their message, and they end up developing that into a strength. So to be able to have the tools identified to be able to do that is a pretty exciting thing for families.
It really is, yes. I think it's important to add, too, is that I know we're used to, some assessments can take, 6 weeks plus to get the results back. I know with Liberty, you'll get either the same day or by the next day. I'd say 99% of our cases, we do an assessment that day, and I'm going to call you by that evening and tell you whether you're in the program or not, just to go on to the next step. So I think that's also a plus for families who have been waiting and waiting, and some like, oh, that assessment's going to take forever. No, we're going to let you know.
Yeah, that's really an incredible thing for families, and knowing again that there's no cost to families for going through that assessment.
Yes.
So if that's something that you're worried about, because we all know that if we get to the children early, if we can start to identify some of these children when they're starting to exhibit some mental health issues at a young age, that we can develop those strengths and work on those needs at a young age and help them develop into healthier, even young adults. So that's an exciting thing.
Right. I think it's also important to add, we use the terms, emotional disturbance, severe emotional disturbance, to get qualified in the program. That can scare a lot of parents away. It's really and again, even if you think there might be a need, it's okay if you think there might be something going on, we'd love to come in and check out and help you to see if there is a need or not. So it's not exclusive, just that there's severe problems going on versus there's kind of a problem going on. We're here to assess from 0 to 100. So.
Right. And as part of the settlement agreement, it was the state of Idaho was tasked to not only develop a system of care that addressed kids with those severe needs that maybe weren't getting the services that they needed, but we were also tasked with being able to identify any unmet need, to really get out there to those families that were just beginning to see some issues going on for their child, all the way to those that were in residential care. And so again, this is part of an evolving and changing children's mental health system, but that's the exciting part about the CANS, is it is going to look at things in terms of the functioning of the child and the family, and that helps to get that unmet need. Oftentimes we look at kids and we just see the current pressing issues, when in the reality there's a lot of other things going on. We're only seeing the tip of the iceberg, and there's a lot more going on underneath. Yes. The CANS tool will allow us to be able to look at overall what's the functioning for that child and family. And because it's your story, you get the opportunity to prioritize what needs to be dealt with first. If your family needs respite right now and you need to utilize the CANS as a way to be able to gain access to services, it can be used that way, just so your family can get a break. And then it can go back and you can look at, okay, here's all the other needs for my kids. I'm going to prioritize this need first, and that's what I'd like to see happen in my treatment plan.
Right. And those are all, it's just a fabulous way to start to deal with this issue in a completely different way. And I hope you all realize these are two great examples of people that really they're indicative of the other people that are in the system, that are trying very hard to design a system that really is person-centered and family-centered and does take into account the needs and the strengths of the entire family, to get to these children early, to help the families before they get into crisis. We know there's so many families out there that are already in crisis. And the hope is that, a few years from now, when this has been going a little longer, that we'll be getting those children early and helping the families sooner. But as a parent of a child with severe emotional disturbance, I want to let all the other parents out there know, we understand you've been parenting off script for a really long time, right? Parenting a child with severe emotional disturbance doesn't look anything like parenting a neurotypical child. And as a parent network, we understand that, and we are here to help you. So if you have questions, again, now, please go ahead and email us at pnregion4@gmail.com. The number should be up on the email address should be up on your screen right there. We'd be happy to answer any of the questions you have. But also, just if you're a parent or you know a parent who's struggling, please go ahead and reach out to us. Let us get you in touch with other parents. We had a meeting last Friday with 6 other parents from just this Treasure Valley area, and the amount of hope and encouragement that they felt having talked to other parents who have been through this process, who live this process, who know what it's like to raise a child when, your neighbors and your community members are looking at you like, really, you raised your child to do that? When you know that really what you're doing is keeping your child safe and keeping your family safe. And we understand that and we get that, and we'd be more than happy to get you in touch with ourselves or other parents who have that kind of similar experience. So is there anything else that you all wanted to bring up today that you think would be important for families to know about the CANS or the CANS process?
I just want to reiterate one thing. we really believe that you are the expert of your child. We are very familiar with coming to an assessment, talk about all these needs and all these behaviors, and then we meet the child, and then the most charming, sweet, mild-mannered, sweetheart you could ever, we trust you. It's so important to know that finally we're hearing you, and we trust your expertise, and we trust that you know what's best for your child, and we're going to document, and we're going to rely on that. So I know so many parents feel like they haven't been heard, and I just want to reiterate, we hear you, we understand you, we are here for you, and that's our intent. We're here to give you hope, we're here to give you help, and we believe you. We're on your side.
So we have a question.
Great.
It says, how do we get an assessment set up, and what if I live in a rural area of Idaho? Can assessors still come to my house?
Yes. Like I said, I just went to McCall. I go all the way out to Horseshoe Bend. We have assessors throughout the state of Idaho. So there's not one little nook or cranny that's not covered. Sometimes it takes us maybe 3 or 4 hours to get there, but we'll schedule the time for that. So anywhere you're at in Idaho, we will get to you, I promise. And again, we have the whole state. We have assessors throughout the entire state. So all nooks and crannies are covered, I promise.
And I don't, Mike, can you go to our slides here? I have included in the slides that will be put up onto the Federation's website when this webinar is posted on there. I've got, I think I'm on it right now. So I've got numbers there for resources of how you can be able to access an assessment. You can find out information about the YES program at yes@dhw.idaho.gov. You can contact the parent network, the PN Region 4 at gmail.com. That's Janet's email through the parent network. You can contact Federation for Families. You can also go ahead and contact Medicaid Self-Reliance. They might connect you to Liberty to start the process. And then Liberty Healthcare's numbers there. You can also contact the Optum Idaho member line. So all of these resources can get you started on your into your assessment.
So if you are looking for an assessment, and that was his first question here, how do we get an assessment set up? If you're looking for an assessment either to access Medicaid because you do not currently have Medicaid, or to access respite, you would go through Liberty Healthcare, and their number is on your screen, 877-305-3469. You call Liberty Healthcare, and it's about a week, I understand. Is that correct? To get a week or less to get the assessment time set up and have them come to your home to complete that assessment. So please don't hesitate to do that. If you already do have Medicaid and you don't need respite, you can call your local children's mental health office to get a full CANS that way. But please do reach out. Do get an assessment for your child. If this is something that you feel like your child has a mental health issue that you want addressed, please call Liberty, call the Department of Behavioral Health, reach out to me directly. We will get you in touch with the right people and make sure that you get the assessment and you get the support that you need.
Right. And Janet has already mentioned this. Coming July 1, there's going to be new services rolled out into the Children's Mental Health Network, particularly the CANS assessment. So community behavioral health providers will be able to provide the CANS to you. So if you've already got Medicaid and are not requiring a respite as a service, then you will be able to, beginning July 1, connect with your local community behavioral health provider.
And know, too, that starting July 1 is really the first of the rollout of all of the new services and supports that are going to be in place for children and families throughout the state. There will be 26, I believe it is, new total services and supports that are rolled out for families that are all YES compliant, so they are going to be family centered, and these will all be rolled out over the next year and a half to 2 years. So
you can find out more information about the specific services, the definitions of services on the YES at dhw.idaho.gov website.
Right. So please do go ahead and look there if you have any information. If you've struggled to find the information, reach out to me. I'll be happy to help send you direct links so you can find the information yourself. And so,
any other questions? Or
that was all we had there. So
all right, wonderful.
Okay, an hour goes by quickly.
It does.
Yes, it does. Yes, it does.
All covered a ton of information. Did you actually get to all the PowerPoint slides, or did we shortcut?
Yes.
Okay,
Yeah.
Awesome. Okay. Once again, thank you for joining us. I loved, because it was such a come from different places, that you had perspectives that really kind of filled out and gave a really full perspective of, so parents can understand from all angles what the experience is going to be like.
Yes.
Yeah. So We will not be doing a YES webinar in June. July, we're going to do Principles of Care, Access Model, and what the Child Family Team is. So there's a lot of information that's going to be packed into that presentation. Don't have the date specific, I'm sure, right now, so that will be both on our website and different promotions that'll be coming available. So my guess is that we will see you ladies again.
Love to.
I don't think this is a one-time deal, so we look forward to seeing you back. And as I said, please send your questions. Let people know about this. I mean, share with friends, family, anybody you think that this is valuable information. The more that we can help get it into the community, the better we feel like families are going to be served and they're going to know where to go for help. So thank you for joining us. Thank you for being here, and on to the next one.
Thank you.
Thank you.